Sounds of mourning and a vacuum, that is, as a popular nationwide radio show in the U.S. played an abortion on the air. National Public Radio aired the piece yesterday. The reporter behind it says with abortion on the ballot next week, she wanted to let people know exactly what's happening inside an abortion clinic. Joining us now with more on this is Katie Glenn, State Policy Director at Susan B. Anthony Pro-Life America. Katie, always a pleasure to speak with you. Now, the segment from NPR is very graphic and tough to listen to. What's your take on this, and will it sway voters in any way?
Well, I agree with that journalist. Americans do need to know what abortion is because we've already lost over 63 million Americans to legal abortion in the last 50 years. I don't think it will have the effect that she thought. As I looked at the comments on the article and online, people were horrified. They were literally listening to that baby die. And by 11 weeks, that baby's heart has already beat over 9 million times. So while she thinks that people will hear it and say, wow, that's normal medicine, I think there's going to be a backlash to that. People hear it and say, wow, now I know what an abortion is.
I was taking a look at some of the other headlines on the internet, and this week the U.S. Food and Drug Administration warned about abortion providers pre-prescribing abortion pills, essentially allowing women to stockpile the drugs before possible state restrictions would take effect. Have you heard anything about this?
Well, we saw the FDA come out against the Biden administration, against their own bosses for these political appointees who have said abortion on demand, full speed ahead, no rules. The FDA said, actually, this is very dangerous. If these pills are being advance prescribed, which means they're being sold to a woman who's not pregnant, we don't know who's taking them. We don't know that they've been screened. In fact, they probably haven't, because if they went to a doctor, they'd get the pills from a doctor, not from a friend, not from a neighbor. And we don't know what kind of follow-up care is available for her if she does have a complication. So we were glad to see the FDA, for once, stand up against this radical abortion agenda and say women's health is at risk here.
And along those same lines, your organization recently broke a story about underground drug rings smuggling abortion pills across the southern border. Tell us more about that.
Well, the Washington Post reported, I think very honestly, about these underground abortion rings where they're literally carrying duffel bags full of pills across our southern border. There's an organization that gets drugs from Mexican manufacturers who give them drugs that are about to expire. So this is medication that could not be sold, and they are giving it out to women with no follow-up, with no counseling, not telling them that they really do need to see a doctor, and they have no sense of what happened. And one of the stories that we came across when we were researching this was of a woman who received this medication in a medicine bottle from a veterinarian. It was for a cat flea medication.
My
goodness. And her boyfriend said, I don't know if you should take this. It might be fentanyl. And what ended up happening, the reporter was there with her as she delivered her baby into the bathtub.
Wow.
And she said, it looks like a baby. That is an experience that American women and women around the world are having. They're told this is not a big deal. This is just like your period. And they're finding out the reality is this is a baby.
That's so hard to take, I got to tell you. I also wanted to ask you about a new movie called Jane. Actress Elizabeth Banks stars in the 60s era woman who seeks to help an underground network to get an abortion, and it was just released this week. Your thoughts on it? Have you seen some of the previews?
Well, I went and saw the movie, so you don't have to.
Okay.
There were 3 of us in the theater, but I did sit through the whole thing. What bothered me the most about this movie is it's very clearly trying to glamorize abortion underground, which, as we just talked about, we've been reporting on how dangerous this is. One of the claims they make at the end of this movie is that this group, Jane in Chicago, did 12,000 abortions over several years before Roe versus Wade, and they say they never hurt anyone. We know from records and from memoirs written by members of that group, women hemorrhaged, women were infected, women went to the hospital. Several women even ended up having to get hysterectomies and were never able to have more children after abortions that they got through Jane. So the claim in this movie that this is totally safe, that nothing bad will happen, that no one is ever hurt by underground abortion or by abortion generally, because we know women are also hurt from legal abortions that are happening in abortion clinics. It's just flat untrue, and it's clearly propaganda, which is why Planned Parenthood is fundraising off it. But by and large, the American people are not seeing this movie.
Now, you had mentioned this, that there were only a few people in the movie, so it's more than likely a bust at the box office. What do you think about this buzz of this movie?
Well, I won't say I'm sad to see that it's not doing well financially. I'm not surprised that groups like Planned Parenthood are holding fundraisers where they show this movie because it's matching their agenda. It's matching the language they say to sell abortions. So I think it tells a sad story of a woman going through a really hard time who ends up getting pulled into this group, Jane, and kind of abandoning her family. It tries to portray her husband as this villain who just doesn't understand her when he's really very forgiving. When he finds out she's doing an abortion and he says, "You are operating on people," like, that is crazy. I think that is the message that everyone should take away from this movie, is that the idea of somebody operating on another person who has no medical training is crazy and it is dangerous.
Well, Katie Glenn, thank you so much. State Policy Director at Susan B. Anthony Pro-Life America. Always a pleasure.
Thank you.